On March 20th, I was dispatched to one of our local trailer parks for a welfare check on another individual. When we get called for a welfare check, it's to guarantee the safety of the person. We go there, make sure that they're emotionally okay, physically okay, they have food, water, all the resources that they need to survive on their own. And if we feel the need, sometimes we contact another family member or a friend to be there with them just so they're not alone. I was informed that the other family member might be across the street at another trailer, so I walked across the street. I observed that the far shed in the back of the property was open, but it's not uncommon for people to leave their sheds open. So as I knocked on the door, I heard a voice coming from either inside the trailer all the way in the back or in the shed itself. So I again asked, after I knocked, addressed myself as Tiffin Police, and then heard the voice coming from the shed. So at that time, I found a man standing on a lawn chair. He had his arms braced out on two shelves of the shed, and his upper body was obstructed by a light fixture that was hanging from the shed rafters. I talked to the man momentarily, asked him if he knew where the other individual was that I was there to find. He said he didn't know where he was, and then I moved just slightly to where I could see his face, and I observed that he actually had a cord wrapped around his neck that was tied to the rafter, and he was standing on the edge of the chair. It went from, this is going to be a really weird conversation talking to a guy on a chair, to we now need to completely regroup and dive into some of our CIT training, which is crisis intervention training. Being able to de-escalate a situation, create a rapport, and try to bring down a situation that could be either dangerous or deadly. Once I realized what was going on, I had to either choose to be authoritative or try to appease to his emotions, and I chose authoritative. I instructed him that, hey, we're not doing this today. I need you to get down. And he was kind of half-heartedly about it. And he did eventually come down after we talked a little bit longer, but the entire time I'm talking to him, he's still standing there with a cord around his neck, standing on the edge of a rickety lawn chair. So it was I need you to come down, I need you to come down. And then eventually he did decide against it, saying that he was trying on a necktie. We moved out of the shed, and then we had a further discussion, and I informed him that because of this, I could not take it as a joke. I couldn't find it half-heartedly. We were going to be taking him to the hospital. He was going to be seen by a medical personnel there, as well as a counselor there, to find out that his sister that he had been living with had recently died, and the power had been shut off to the trailer that day. He had, a couple months prior, been in an automobile accident where he was struck by a car walking and had severe damage to his leg. He was actually supposed to go to the hospital today anyways to get his leg looked at, which was severely infected. So all of this had compiled on him, and then we talked ourselves through it, and I got him what we call a CIT form. And a CIT form for us is we go to an online database, we type in all the information of the incident that happened, all of his contact information, how they can find him, and then we set up follow-up counseling, whatever hospitalization they need, and then they make sure that they keep up on that. I feel that CIT training is absolutely essential, and the Tiffin Police Department has made that a #1 priority for all of our officers. Whether you're 6 months in and you've transferred from a different department, or if you're fresh out of the academy, because mental health changes constantly. So we have to be ready to handle and de-escalate and be able to just empathize with different kinds of mental health. So CIT is a #1 priority for Tiffin Police Department. So about a week later, after he returned from the hospital, I did check up on the individual, and he was more than happy to talk to us, and he was doing just fine.